Hold on, guys. I'm going to do a video today about going to the doctor. I think if you've got a problem, because it seems to be a big issue why a lot of men, in particular, don't get problems sorted earlier on. I had no option really but to approach the doctor early on. Um, First was out hours, and then later was through my own doctors. So obviously, this is going to be on the basis that you've had telephone consultations or going in for a face-to-face consultation, which I did quite a bit later on. I'd been several months down the line before I actually got a face-to-face consultation with my doctor before after trying various blood tests, urine tests, meds and bits and pieces. When we got to the point, I thought, well, we're going to have to have a physical exam to see what's going on. So if you're finding yourself with some a lump that's come up on your balls, your shaft don't feel right, there's problems urinating, pain in your pelvis, pain during sex, problems with having a hard on, could be. I'm going to treat this basically on urological issues. Um, Men seem to be most embarrassed to go to a doctor about. So you've had your telephone consultations, and they're at the point really where they want to examine you basically. Now you may have a male doctor, you may have a female doctor. I chose to go with a male doctor initially because it's easier to describe male orientated problems to a male doctor than it is to a female doctor. If you've only got access to female doctors, then you just got to speak to female doctors. I think from experience, female doctors seem to be more sympathetic than male doctors do. I don't know why, but that does seem to be the case. So they've called you in to do a physical exam for whatever reason. There's nothing to be particularly worried about. Your modesty is protected as much as possible, really. Depending on the doctor, they'll may ask you to strip from the waist down. When I went to see my urologist, he pulled up my t-shirt first to check the extension on my bladder, and then between the two of us, we eased my trousers and boxers down, sort of like mid-thigh, and they do a genital inspection, and then a DRE. When I went to see the doctor, I just stripped from the waist down, lay on the bed. It was all behind a curtain. Um, and yeah, I suppose if you're not used to showing your tackle to anyone other than your partner, this could be a little bit daunting. But at the end of the day, these are medical professionals. They don't really care what you look like. They're going to seen it all before. So unless you're hung like Sugar, they're not going to be that particularly interested. They're more concerned really that they're going to not find anything untoward. So we'll start with a genital inspection first, really. Now you may have pain in the shaft, problems with erection. You may have found something on your balls. It pays to check these regularly, guys. I get my missus to fondle them. It's not, in a way, really, it's good that she does because she knows how they feel. I know how they feel. So if I found something, I thought, that don't feel particularly right, she knows what they feel like, and to say, oh, well, yeah, there's something that's appeared that wasn't there before. If you do a lot of contact sports or a lot of off road biking, motocrossing, it would pay really to check yourself quite regularly because you'll probably get you may get impact cysts pop up from time to time, which will need to be checked out. It's probably going to be benign and nothing to worry about, but there's always at one time you could have a lump come up. And testicular cancer is particularly big under the age of 40. Over the age of 40, it's prostate, guys. I'm sort of in that somewhere to nowhere at the moment at 35. So, with a gentle, ordinary going on, I think they check your bladder distension first, especially if you're having urinating problems, and then move on down to the genitals. Could be a situation where you could get hard on, depending on how sensitive you are. I did both with a male doctor and a male urologist, just their sensation from them palpating your shaft is all the kind of stimulation you would normally get sexually, and you have to try really hard not to get hard on. I had to sort of look away and think of something else, sort of thing, because you sort of feel things twitching there. If you get a hard on, the end of the day, they aren't going to worry about it. It's just a general reaction. They'll inspect the shaft and the meatus and the foreskin, and then they'll palpate your scrotum to find a lump if there is a lump there, or to check for lumps generally going on. They may do the standing. I've seen videos on YouTube where they do it standing. Most doctors in this country seem to do it lying down. This is how the urologist did it as well. And then, depending on your issues, if you're over a certain age, they made you a DRE. Point of fact, I had a DRE because we thought I was suffering from prostate-related issues. So they'll ask you to lie on your side, pull your legs up to your chest, and they'll slip a lubricated finger, which is, it's not unpleasant. It's a little bit uncomfortable, and they'll just palpate your prostate. If you're not used to prostate stimulation, it does feel very strange. There's a pressure that almost makes you feel like you need to pee. You don't want to be needing a pee at this time because it will be very uncomfortable. If you're obviously suffering from prostatitis, it could be extremely painful. Um, Obviously, let them know if this is the case. Generally, going on, it should not be painful. It does depend really on what your symptoms are. Again, there's no need to be squeamish about any of this. It's nothing the doctors aren't used to doing. Yes, it's a bit uncomfortable. It's hardly the end of the world, and you really just, if you're that anxious about it, you really just got to suck it up and get on with it at the end of the day. It's the only way these things are going to be checked out and kept on top of it. Really, I was told by my doctor that I had a slightly inflamed prostate, which in fact we looked like I was suffering from prostatitis. Would have been about right, really. By the time I went to see the urologist, he claimed that my prostate was wide as opposed to inflamed. How you can quite have a wide prostate, I don't know, but that's what his description was of it. It was slightly wider than what you'd expect from for a man of my age, but it wasn't enlarged or inflamed. This was after about a month of taking trimethoprim, so any inflammation could have gone down. But he did find it was slightly wider um, than a prostate for my age. Again, the urologist did all the same kind of examination that the doctor did. If by which point you get referred to your urologist, so I guess it's again the same kind of inspection. Um, Again, the DRE is done laying on your side. Um, Pictures, or some of the videos on YouTube, they see it being done when you're bending over a table or a bed. It doesn't tend to happen in the UK. I think the more American option, really, the preferred option in this country is to lie on your side and pull your legs up to your chest, which is the most. I think it's to give you the most relaxation in terms of your sphincter muscles, in terms of them doing their a DRE. So that's your doctor's appointment, really. I've never had to go for an ultrasound on my genitals or transrectal ultrasound. So they've found a lump on your balls or something in your shaft that doesn't look right, or something about your prostate that doesn't look right. So they've referred you for an ultrasound. I think I may have covered a bladder ultrasound in the previous videos. It's not. You want to get an ultrasound centre fairly close to you. I was lucky mine was only a short period away, and unfortunately, I was having a bad day. I drank as much as I dared before the appointment. I ended up peeing several times before I actually got in to go in to have the scan, because you have to go with a full bladder. They scan your bladder full. You go for a pee, come back, they scan your residue as accurately as they can. Scan your kidneys and your prostate and your bladder. If you're going for a genital ultrasound, they will probably ask you to change into a gown. Again, the guys will probably leave your t-shirt and your socks on. And obviously the gown will be removed enough to access your testicles or your shaft. It's going to be cold because obviously anyone who's had an ultrasound on any part of their body, the gel is quite cold. It'd be quite sticky, quite messy. I think they use the same scanners they use for legs and abdomens and such like. There'll be a bit of pressure and a bit of discomfort, but and again, these guys have seen it all before. Again, unless you're hung like sugar, you're not really going to impress them. It's highly unlikely you're going to get a hard on in this circumstance. Just the coldness from their ultrasound scanner is going to be enough. If you go in for a transrectal ultrasound for your prostate, I've seen them use the probes before. My wife for a transvaginal. They're not massive. They're probably equivalent to two fingers. So you're going to feel a bit of pressure and a bit of discomfort. They're well lubed up. I think they put a condom over them first, so no risk of contamination between patients. And again, obviously, once it's inside, there'll be pressure against the prostate while they're scanning for what they need what they need to do, again, it'll be over quite quickly. Again, you'll be in a gown. Most likely not, they'll probably do it have you lying on your side with your legs pulled up to your chest. They may do it with you on your back with your legs spread, but it's more likely not. It'll be on your side. So I'm quite lucky. I've not had to have any genital or transrectal ultrasounds. I've only ever had the bladder ultrasound done. I'm lucky. I've never had no issues with my balls or my prostate. So again, guys, yeah, it's not ideal situations, but if you're suffering, for Christ's sake, don't carry on suffering. The amount of men over 50 I speak to, oh, I've got poor urination, oh, I'm dribbling, or can't go, or go and I need to go again, or and you think, well, just Christ's sake, man up and go to the doctor. No, end of the day, they can't do nothing. They don't know nothing about it. Once they know what's going on, you've got some chance of being treated. Obviously, my other videos cover flow tests, urodynamics, cystoscopies, rigid cystoscopies, and such like. So this is more just a general video of if you've got a problem, going to your doctor. I said, at the end of the day, they've heard it and seen it all before. At the end of the day, is very rarely you're going to go in with something they haven't seen before, haven't come across before. My symptoms are a bit strange and unusual, but generally going on, if you're over 50, you could be suffering from BPH. If you're under 30 and a lump comes up, again, it could be benign sort of thing. Now, in extreme circumstances, you may have to have a testicle removed if something's gone cancerous. But again, the earlier you catch it, the earlier it can be treated. And like with enlarged prostate sort of thing, there's so many new radical um, treatments coming out now that are cutting edge, really, at the end of the day, for treating enlarged prostates. And they've all caught before time. I said, and they don't want to end up in a situation, especially with your prostate, where you go down the route of a prostatectomy because it causes so many issues long term: incontinence and erectile problems, nerve problems. Won't be able to ejaculate anymore. This is obviously different to still have an orgasm. Yes, you want to catch this stuff really early on. Something there's too many men really just, oh, I was getting old. It's not getting old. There is something wrong at the end of the day. You know, having a large prostate is a risk of getting old. Some men will end up in their 80s and 90s and not. It always used to be a thing years ago, probably about 10 or 15 years ago. They were stating that more men die with prostate cancer than because of it. And unfortunately, it's changing. Whether people are developing the cancer younger, I suppose people are living older than they used to, whether it's a change of diet sort of thing. So you just can't ignore these things. Oh, it's getting old. It's like somebody having you started getting dementia or forgetting things. You turn and say, oh well, it's not just getting old. No, it isn't sort of thing. There's deterioration and there's stuff that shouldn't really deteriorate just from getting old. So if you're watching this video, hopefully it's helped a few of you guys. Encourage you guys to go to the doctor. I said over 50 sort of thing. You really need to get your prostate checked once a year, even if it's just peace of mind. It's so quick, so easy to have done. I know doctors don't really want to see people these days. They don't particularly make it easy to what they used to. But get yourself booked in once a year, have a prostate exam, and all things being well, it's going to be no different from the year before. If you've got a slight enlargement, they can catch it early enough, put you on tablets that will help. If you just beginning to start having bladder issues, it's easier to catch them early on and leave them get to the point where they get further and further down the line and you get more and more problems, because the further it goes down the line, the harder it gets to treat, the more invasive the treatment's going to be, and the worse it's going to be for you long term at the end of the day. And obviously, I think this month is Prostate Awareness Month, Men's Health Month, something like that. There'll be the probably usual full Monty done by Ashley Banjo again towards the end of the month, early part of December. Raising awareness for men's health, mainly testicular cancer and prostate cancer. So check yourself out, guys. Get your partner to check yourself out. If you've got problems, get to the doctor and get something done about it. Right, sign off for a minute. Cheers and bye.